Everyone. Thanks for taking time out of your day to listen to the open enrollment presentation for your 2016-2017 benefits through American HOWA Kentucky. My name is Julie Martin. I'm from Nice Lukens. We are your broker. We work with your corporate HR staff and your management team to bring you a comprehensive benefits package. You'll see that this year we tried to keep the benefits as close to current as possible, and we've also made some carrier changes to enhance the coverage that you currently have today. We're going to begin with your medical benefits. Those are going to continue to be offered by Anthem Blue Cross and Blue Shield. You still have the option of the traditional PPO plan that gives you a $1,000 deductible for single and $2,000 for family. The out-of-pocket on this plan is $4,000 single, $8,000 family. Your inpatient and outpatient, so for your hospital stays, outpatient surgeries, high-cost radiology like MRIs or CT scans, those services would be subject to the deductible and then covered at 20% coinsurance. Your office visits when you go for a primary care visit are a $25 copay. If you go to a specialist like a cardiologist, that would be a $40 copay. If you're having any preventive care done, that would be covered at 100%. Emergency room. We want you to use the emergency room in the event of an emergency only. If you feel you're going to lose life or limb, please go to the ER. But if you have a scratchy throat or a runny nose, you may want to utilize an avenue like an urgent care center or your primary care doctor. The emergency room is expensive for you. It's a $250 copayment plus 20% coinsurance. It's also very expensive for the plan. Your average emergency room visit runs around $1,500. So I always tell folks, if you're having chest pain or your bone is sticking out of your arm, go to the ER. For anything else, urgent care or a primary care doctor. Right below urgent care, you see that urgent care is a $75 copay. It's listed right under the emergency room. And then right below that, you see your prescription drugs. These are the exact same benefits that you had as last year, so your drugs are broken up into 4 different tiers, and each tier has a copay that's associated with that. So Tier 1 drugs are mainly your generic drugs, $15 copay for that. Your Tier 2s or preferred brands are a $35 copay. Your Tier 3, your non-preferred brands, are a $55 copay. And your Tier 4 drugs, your specialty injectable type drugs, those drugs are a 25% copayment. Right next to that, you see the 90-day supply, and you can get a 90-day supply by utilizing the mail order service through Anthem and Express Scripts. For Tier 1, it's a $38 copay. For Tier 2, it's an $88 copay. For Tier 3, it's a $138 copay, and for Tier 4, that's 25%. So you can see the benefits on the PPO plan as well as the HSA have remained exactly the same for 2016. Moving over to your high deductible health plan, so $2,600 deductible for single, $5,200 for family. Your out-of-pocket, $3,500 for single, $7,000 for the family. On this plan, you're going to notice that you don't have any deductibles. Well, you do have a deductible, but you don't have any copays. So your prescription drugs, your office visits because you're sick, any inpatient or outpatient hospital stays are all going to accumulate toward that $2,600 deductible. Once that deductible has been satisfied, you won't have to pay any additional monies for inpatient hospital, office visits, specialty visits, emergency room, or urgent care. But you will have copays for your prescription drugs, and that's how you're making up that additional $900 to hit the out-of-pocket limit. So after your deductible is satisfied, you'll have a $10 copay for Tier 1 drugs, a $50 copay for Tier 2 drugs, a $75 copay for Tier 3 drugs, and that same 25% copayment for Tier 4. On this plan, that for the 90-day prescriptions, it's a $10 copay for Tier 1, so that's buy 1 month, get 2 months free, a $125 copayment for Tier 2, and a $225 copayment for Tier 3. And you have that same 25% for Tier 4. Just a reminder, and I mentioned this before, your preventive care is covered at 100%. So if you go for immunizations like a flu shot, or if you're over age 60 and you want to get a pneumonia vaccination or a shingles vaccination, that's covered at 100%. So ladies, your well woman checkups, if you have children covered under the plan, any of their well baby or well child checkups are covered at 100%. Any childhood immunizations or vaccines that they would need, those are covered at 100%. Any mammograms, blood pressure readings, cholesterol tests, colonoscopies for those who are over age 50, all of those services are covered at 100%. Just a reminder that your provider does have to bill the claim as preventive. So if you are having some type of stomach issue and they want to do a colonoscopy to diagnose what's wrong with your stomach, that wouldn't be considered preventive. That colonoscopy is being used to diagnose a particular condition, so that would be subject to the deductible and coinsurance on either plan. But if you're over age 50, it's just time for you to have one. It's going to be covered at 100%. Just some things to keep in mind about your PPO plan. All your co-payments are going to apply to your out-of-pocket limit. And this is relatively new. This is a change under the ACA. So the out-of-pocket is now a true out-of-pocket limit. So every time you go to the doctor or pick up a prescription, that co-payment is going to apply to that out-of-pocket limit. So it's a true out-of-pocket. Just a reminder that you're on a calendar year deductible. So it runs from January 1st, 2016 through December 31st, 2016. Any amount that you meet through February 29th is going to be carried forward to your new plan. And then your deductible is going to reset on January 1st, 2017. So if you choose to move to a new plan, say you want to move from the HSA to the PPO or the PPO to the HSA, any deductible credit or out-of-pocket credit that you've had so far this year is going to be carried forward to the new plan. So you're not starting over at zero. If you choose the high deductible health plan, you have the option to open a health savings account. And HSAs are used in conjunction with a high deductible health plan. So if you'd like to open a health savings account, you have to elect that high deductible health plan. And an HSA is an account owned by an employee used to pay for current and future medical expenses. And here's just another reminder that this plan too is on a calendar year deductible that runs January 1st through December 31st. And any amounts that you've met toward your deductible or out-of-pocket already in 2016 will be carried forward to your new plan. Your deductible will reset on January 1st, 2017. To be eligible for an HSA, you have to be covered by a high deductible health plan. You can't be covered by another health insurance, including a medical FFA. You can't be enrolled in Medicare, and you can't be claimed as a dependent on someone else's tax return. Since these accounts are given tax advantage status by the IRS, you do have to meet some stipulations in order to contribute. What makes an HSA different? There's no use it or lose it rule like a flexible spending account. So all amounts in the HSA are fully vested. So as soon as that money goes into the account, it's yours. Unspent balances in the accounts remain in the account until they're spent. So it rolls over from year to year. So say you had a really good year health-wise and you have $1,000 in your HSA. That's just going to roll over to the new year, and that can help you pay for expenses when you have not such a good year health-wise. The account belongs to you, the employee. So if you ever terminate employment, that account goes with you. It also encourages you, the account holder, to shop around for the best value for your healthcare dollar. Since you're responsible for the first $2,600 on the HSA, you may be inclined to be a little more selective when it comes to your healthcare services. There is a tool on the Anthem website called the Cost Comparison Tool. It has 150 different procedures. You type in your zip code, and then it will give you the facilities and the cost for that particular service. So if you know you're going to have a knee replacement, or you know that you're going to be having a baby, you can see those costs and see how they could differ from facility to facility. And if you're able to, you can ask your physician if you could have a procedure done at a certain facility if you'd wish. And your accounts can grow through investment earnings just like an IRA. So once your balance gets to a certain level and you know that you have enough to cover that deductible and out-of-pocket limit, you could choose to invest some of those funds. It's up to you. Health savings accounts are given tax advantage status by the IRS. So there are some limits on how much you can contribute. There's not any restriction on how much you can have in your account, so the balance can be as high as you'd like, but there are limits on how much you can put in there each year. And it is a combination of your contributions as well as your employer's contributions. So for single, $33.50. For family, which the IRS considers anything other than a single, so for employee plus spouse, employee plus children, or full family coverage, you could contribute $67.50. You can also put in what we call a catch-up contribution of $1,000 if you're age 55 or older. If you elect the health savings account option or that high deductible health plan, AHK will be contributing $500 for single coverage and $1,000 for all other tiers. And those contributions will be put into your account biweekly. This next slide talks about HSA distributions. And the question is, should the HSA account holder keep receipts? And you can see the answer to that is a big bold red yes. You may need to prove to the IRS that distributions from the HSA were for medical expenses and not otherwise reimbursed. You could be required by the insurance company that your deductible is met. And not all medical expenses paid out of the HSA have to be charged against the deductible. So if you had dental or vision care, you can use the HSA for that, but it wouldn't apply to your medical deductible. This also comes in very handy if you're audited by the IRS. I like to use a pretty low-tech method on this. I have a big manila envelope. I put the year on it, so my one for this year says 2016 HSA expenses. Each time I use my HSA to pay for a doctor's visit or pick up a prescription, I put that in my manila envelope. At the end of the year, I close up that manila envelope and I attach it to my tax return. So in the event I'm ever audited and the tax man asks me, can you provide substantiation for these distributions from your HSA account, I can hand over that manila envelope and say, yes, I can. If you're unable to produce documentation like that, the IRS will tax that money as income and then slap you with a 20% penalty. So if you're on the high deductible health plan and you're using the HSA to help pay for those qualified medical expenses, please institute some type of record keeping, even if it's my simple method of the manila envelope. You want to make sure that you're able to use those funds tax-free. Okay, these next couple slides are going to give you an example of how a particular scenario would pay out on a high deductible plan as well as the PPO plan. So for this example, we're going to use a catastrophic illness, and it's a $75,000 claim. And we all know with the cost of health care that that's pretty easy to do. So on the high deductible health plan, that deductible is $2,600. The employee is responsible for that $2,600. You can access the HSA for available funds. You know that AHK will contribute $500 towards your health savings account. So you would be responsible for that other $1,900. So you could either use your personal funds or funds from your HSA account. And then the insurance plan pays the remaining $72,400 because the plan pays 100% after the deductible is met. So worst case scenario, this is going to be $2,600. That same example on the PPO plan, have a catastrophic illness, a $75,000 claim. On this, your plan deductible is $1,000. After the deductible is met, the employee will pay 20% of the remaining $7,400 until the $4,000 out-of-pocket is met. After the out-of-pocket is met, services that apply to the deductible and out-of-pocket will pay at 100%. So employee would be responsible for $4,000, and the plan will pay the remaining cost at 100%. After the out-of-pocket is satisfied, all services, including those services with co-payments like office visits, emergency room, and RX, will pay at 100% for the remainder of the calendar year. So on this particular example, your maximum out-of-pocket is going to be $4,000. Okay, moving on to your dental. Dental is going to remain with Anthem, and you all utilize the Anthem Dental Complete Network. And on this plan, single deductible is $50, family is $150. Your annual plan maximum, which means what the plan will pay out on behalf of each member, is $1,500. There are no waiting periods. So your type 1, your preventive services, they're covered at 100%, and the deductible does not apply. Your type 2, your basic services, things like routine fillings, are subject to the deductible and then covered at 80%. Then your type 3 services, major services, inlays, onlays, crowns, prosthodontics, implants, endodontics, and periodontics are subject to the deductible and then covered at 50%. Also on this plan, orthodontia is covered for children up to age 19 only. It's 50%, not subject to the deductible, and it's a $1,000 lifetime max benefit. Just a note, if you visit a non-participating dentist, they may balance bill. So what that means, since they are not in network with Anthem, they can charge you the difference between what they bill and what Anthem reimburses, and we refer to that as balance billing. So say you got a filling and the billed amount was $100, but Anthem reimburses $50 on that. If you visit a non-network or a non-participating dentist, they can bill you the difference between the $100 billed and the $50 allowed. So you could get a bill for $50 if you use a non-participating dentist. So go to Anthem.com, look at the Anthem Dental Complete Network, and make sure that you're utilizing a network dentist if you're getting extensive dental work done. Your vision is going to remain with Anthem. Have the Blueview Vision product. On this plan, you can get an exam every 12 months for a $20 copay. There's a retinal imaging benefit, and what this does is it replaces those dilation drops that they put in your eyes. I don't know about you, but I really don't like to have my eyes dilated, so I opt to have this retinal imaging benefit. And what it does, it takes a picture of your retina, and the doctor's able to look at that picture and see the same things that they would see if they dilated your eyes, but you don't have to wear sunglasses for the rest of the day. So if you do that, they can charge you up to $39 for that, but nothing more. And there's also a contact lens fitting option. So they can charge up to $55 for a standard contact lens fitting and follow-up, or 10% off a retail for a premium contact lens fit and follow-up. The vision benefit also has frames. You can get frames every 24 months for a $20 copay, and that gets you a $130 allowance plus 20% off that balance over $130. I don't know about you, but I can't find glasses, they're cute, that are less than that $130. So if you like a pair of frames that's $200, Anthem's going to give you $130 toward that, and then 20% off that remaining $70 balance. So if you like the pricier frames, they do help you out a little bit with that. You can get lenses for your glasses every 12 months. So for single vision, bifocal, and trifocal lenses, and these are your standard plastic lenses, you can get those for a $20 copay. For standard progressive lenses, or what we call no-line bifocals, those can be covered at a $65 copay. There's also a premium progressive lens, and those are broken up into 3 different tiers. So tier 1 is $85, tier 2, $95, tier 3, $110. There are hundreds of types of progressive lenses. And what's nice about vision is that it's real-time processing. So when you're there at the eye doctor, they can tell you if you have a standard lens or a premium progressive lens, and then they can tell you exactly what that copay is. So they can check all those things out for you beforehand, before you check out. Or you could choose to use your vision benefit for contacts. I wear my contacts every day, so I choose to use my vision benefit for contacts. If you fall into that same camp, if you wear conventional or disposable lenses, you get a $130 allowance towards those. I like to get a year's supply of contacts at once. That way I know I've exhausted that $130 allowance, and that way I don't have to make trips back and forth to the eye doctor. Just like the lenses, this is a once per year benefit, so we want to make sure that you don't leave $1 of that $130 allowance on the table. There's also an additional pairs benefit. So say you do use your vision benefit for contacts and you break the only pair of glasses you have. So if you get a complete pair of glasses, you'll receive a 40% discount. Also, children under age 19 receive free transitions lenses, you know, the ones that turn from light to dark when you go outside, and also free polycarbonate and scratch coating at no cost. We do know that children are much harder on their glasses than adults, so they get these upgrades for free. Your benefits are rolled into one package, so medical, dental, and vision, you get all of those for these biweekly payroll deductions. So if you're employee only and you choose the PPO, it's $22.81. For the high deductible health plan, it's $20.43. For employee and spouse on the PPO, it's $66.92. On the high deductible plan, $59.94. For employee and children, $58.63 on the PPO and $51.87 on the high deductible plan. And for family coverage, $104.25 for the PPO and $93.46 for the HDHP. And just a reminder, for those that elect the high deductible health plan option, AHK will contribute $500 for single coverage and $1,000 over the course of the year for the other tiers of coverage. Your basic life is going to continue to be offered by Anthem, and that gives you a $40,000 basic life and accidental death and dismemberment policy at no cost to you. You also have the opportunity to purchase additional life insurance on yourself and on your dependents. We're moving to a new carrier this year, One America. It has some plan features that are brand new and only available at this open enrollment. So you have what's called a guaranteed issue, and that means that you are guaranteed this coverage with no medical questions asked. So for an employee, you can get $150,000 of coverage for yourself. You can get $75,000 of coverage for your spouse and $10,000 of coverage for your children. And that is all with no medical questions asked. And that's for this open enrollment only. If you would like to get coverage on yourself, you have to get, of course you're going to get coverage on yourself, but if you'd like to get coverage on your spouse or your children, you must get coverage on yourself. And when you elect voluntary life, you automatically get accidental death and dismemberment. At times, people refer to this as double indemnity. So say you pass away due to a car accident and you had $100,000 in coverage, your beneficiary would receive $100,000 for the life payout, and since you passed away due to an accident, they would receive an additional $100,000 as a payout. You also have the opportunity to purchase short-term disability coverage. We refer to this in the insurance industry as paycheck insurance, and this also is guaranteed issue. So there are no medical questions asked. If you elect it, you will automatically be issued this coverage. And what short-term disability coverage does is it helps protect your income if you're unable to work due to a covered accident or a covered illness. It gives you 60% of your weekly income to a maximum of $1,000 per week. Your benefits begin after 14 days, and that's 14 calendar days, not 14 working days. It does cover maternity, and it's a 24-week maximum benefit period. But different illnesses, different conditions, different accidents have different durations. So if you have a baby, you're not going to be off for 24 weeks. You're going to either be off 6 weeks or 8 weeks, depending on your type of delivery. So say that you are off due to an illness. It's been 24 weeks and you're still not ready to come back to work, according to your doctor. So that's when long-term disability would kick in. And this gives you 60% of your monthly income up to $5,000 per month. It's a 180-day elimination period, so it dovetails right into the short-term disability. So it picks up where that short-term disability ends. And the benefit duration, it lasts to your Social Security normal retirement age. So for some folks, it's 65. For some, it's 66. For some people, it's 67. And the plan does offer return to work assistance because we do want you to return to work. This product is also guaranteed issue for this open enrollment only. So if it's coverage that you passed on last year but you think you might need this or the short-term disability, you can get it with no medical questions asked. Up next, you do have a new worksite carrier for 2016. It's AFLAC, so you're going to have accident and critical illness. It's going to replace that Colonial Life coverage, and the premiums for Colonial will not be payroll deducted after 3/1/16. So if you like the accident and critical illness and you want to continue those coverages, you can pick those up with AFLAC. So with the accident plan, you get an emergency treatment benefit, a specific sum injury benefit, accidental death benefit, an initial hospitalization benefit, and a hospital confinement benefit. Everybody knows that duck. Aflac is the best in class, and they do have a one-day claims processing turnaround. There's also a lump sum critical illness, and you may want to consider this plan. It might be the right choice for you. A lump sum benefit is paid directly to you upon diagnosis of having a critical illness event. Your dependent children are covered at no additional cost. Benefits include a subsequent critical illness event with no lifetime max if you have a recurrence or another critical illness later in life. So say you have cancer and then you recover from the cancer and then you have a heart attack, you could have an additional payout on the critical illness benefit. There are no deductibles, co-payments, or network restrictions. You choose your own medical treatment provider. And the thing about the Aflac policies on the lump sum critical illness or the accident, those funds are paid directly to you. They're not paid to the insurance company. They're not paid to your employer. They're paid directly to you. So you can use those funds where they're needed most. So some critical illness events that are covered by the policy include cancer, coma, end-stage renal failure, heart attack, major human organ transplant, paralysis, or stroke. Just a reminder that you must keep your elections in place for the entire plan year, which runs March 1st through February 28th, unless you have a qualified status change or what we refer to as a qualifying event. That could include a marriage or divorce, a birth or adoption of a child, becoming newly eligible for Medicare, or a change in your dependent's employment that affects his or her benefits. So say that your spouse currently covers your children on your plan and your spouse changes jobs. You have 30 days to add your spouse and your children to your plan. If you wait longer than 30 days, you would have to wait until the next open enrollment period in order to get signed up. So if you have any of these events, make sure that you go see your HR department within 30 days. Okay, here are your next steps. Review the information that we've covered. We've also provided an open enrollment letter, which gives you a snapshot and synopsis of these benefits. Think, what coverage do I have? Have I experienced a lifestyle change recently? Can I manage without a paycheck for a period of time if you're considering the short-term or long-term disability? Discuss these options with your family. Sign up for a time slot for your one-on-one counseling session. Attend that session at your location. We've also provided an enrollment form. If you want to fill out that enrollment form beforehand so you know you have all the appropriate information, that would be great. It will also speed up your enrollment process. So please make sure that you have an updated address and that you have dates of birth and social security numbers for all of your dependents. During this session with your enroller, you're going to learn about the value of your benefits, and you can better understand the areas where you may lack protection. So if you're not sure if you need the short-term or long-term disability or voluntary life or accident or critical illness, you can address all of those concerns and questions with your benefit counselor. And just a reminder that open enrollment is a great time to update your beneficiary. If you've had a life change this year, make sure you update that beneficiary. We want to make sure that in the event of your death, that the beneficiaries are paid to the appropriate person. I want to thank you guys so much for your time today. If you have any questions at all, you can address those with HR, and they can reach out to us for those answers. Keep in mind that you will be getting a new Anthem medical and vision card, so keep an eye out for those in the mail. They are delivered in a plain white envelope, so make sure that you don't throw those cards away. So thank you so much for your time, and have a great 2016.